Well, hello again. Um, yeah, there we go. So Dr. Childress is back on the internet. Oh my goodness, I have so much work to do. But the reality and the world keeps moving so quickly, I want to stay. So I'm hopping on just for a little bit, just to talk about one specific event that's going on right now. Facebook and Twitter, I heard, are cleansing their platforms of the delusional beliefs, things like stop the steal and other things like that. Inciting the violence and making comparisons over to like scrubbing their platforms of ISIS related content that incites violence and recruits to the and radicalizes to the delusion, to the pathology. And that is exactly the appropriate thing to do. And what I wanted to highlight is the reference to the American Association. If you look at their description, which I post a lot, they talk about there's two places in the American Psychiatric Association's description of the shared delusional disorder where they discuss where if you separate the secondary case from the then the delusions resolve themselves, sometimes quickly, sometimes, but twice they say that separating the child or the secondary case from the primary case, the inducer will do that. And so that is the intervention. What Facebook and Twitter are doing is the appropriate treatment intervention for a shared delusion, which is you begin to separate and not present the material the, to the more vulnerable mind. And so I just wanted to hop on Facebook Live quickly here and just note the association over to what the American Psychiatric Association recommends, which is this, the protective separation of the child from the delusional beliefs. And that's why it's so important that diagnosis guide treatment. If we don't have a diagnosis, we don't know what the treatment is. But if you tell me the diagnosis, I will tell you the treatment on anything, ADHD, autism, anything. So that's what the association want to point out. And the importance of making decisions based on diagnosis rather than just opinions, and everybody has an opinion. And if there's a difference on the diagnosis or disagreement on it, get a second opinion, get a third opinion, get them all to talk about it and figure out what the problem is, that they can't reach a diagnosis. But diagnosis guides treatment. And for a shared persecutory delusion, the treatment is a protective separation period. Now, in court involved, it's a period because we always want the child to bond to mom and dad. So we're just separating for a while from the stop the steal, so we can recover the child and stabilize the child, stabilize America. No, there's no stolen election, everything. And then once we stabilize the child, we restore the child's contact with the parent, the Republican Party, who hopefully has had some collateral therapy and figured out why they became so abusive before, so they won't do it again. There, right there, in that path is exactly what needs to happen with exactly the same pathology in court-involved family conflict. We need a protective separation of the child from the delusional belief so that we're not trying to wrench the child away from this parent's ripping the child one. No, a protective separation period from the delusional beliefs, which is what Facebook and Twitter are doing now. They're protecting the child, America, from the delusions of the parent who's not normal. Now, in normal, both sides, yes, the Democrats and the Republicans, this is not normal. That's what's important to understand about pathology. You cannot apply your normal way of thinking about things and anticipation about how things are going to go to pathology. Pathology is not normal. And so your normal beliefs about what's going to happen and what people do and what the situation means is not accurate. It would be accurate if things were normal, and they're not. And so we separate the child from the delusional beliefs of the parent that are being imposed on the child by these lies and manipulation, the more vulnerable mind. We recover the child's normal and healthy development, kind of stabilize it, and then we reintroduce the pathogenic parent. Hopefully, they've had collateral therapy and have stabilized. If not, if the collateral parent in 2024 is still crazy Trump mind, then we have to take certain protections to ensure that the abuse doesn't start again. And so the pathology is exactly identical. And that's why I'm taking this opportunity to speak politics that I didn't before, because I want to point out the parallel examples. And this one is just choice for making the association to the American Psychiatric Association's recommendations twice for a protective separation with this specific type of pathology. So in the courts, you want to know what to do with the custody. What should we do? And diagnosis guides treatment. We don't need a custody evaluation. The courts can make custody decisions. There's basically only 3 models. You go roughly 50-50, or you go every other weekend, a day during the week. And that's if you want to give one parent school primacy, or you go school year to one and vacation to the other if you have distance. That's basically the 3 models, and I'm confident the court can decide that, and clinical psychology can work with any one of those models and get healthy development. So the custody is not the issue. The issue is a family conflict that will not stop and will not resolve like 4 years of Donald Trump, because we have a very conflict-high personality in the family. What we need is a diagnosis to guide our treatment plan so we can fix the family, because fixing the family is always in the best interest of the child. We need to move from forensic psychology to clinical psychology. We need to move from politics to healthcare. So with that said, I'm going to go back to work. I say hello to Mr. Pippin here.